All right, we're just waiting here for people to sign on. The participant number keeps rising, so I'll give us another minute. All right, we plateaued at 115. Greetings, everyone. It is great to be here today for our first Health Affairs Forum. I'm pleased that we have many of the amazing health affairs leadership with us today, including Jan Hirsch, the Dean of the School of Pharmacy and Pharmaceutical Sciences, Bernadette Boden-Albala, the Dean of the Program in Public Health and future School of Population and Public Health, Shaista Malik, Executive Director of the Susan Samueli Integrative Health Institute, and Chad Lefteris, CEO of UCI Health. Mark Lazenby, Dean of the Sue and Bill Gross School of Nursing, knew he wouldn't be able to be here. And unfortunately, Michael Stamos, Dean of the School of Medicine, couldn't join at the last minute, and both send their regards. So we expect this forum to be an annual event. And the purpose is to share major updates across health affairs and answer questions that may not be addressed as we meet through the year in different venues or communicate by email. Today, the focus is going to be on major capital projects across health affairs, since they will impact so many of us. I thought I would start with a brief update, more general, and I do apologize to those of you who may have seen some of this material and presentation over the last month or two. I'm going to start with this montage, which I really like because it shows our organizational structure. And it reflects the unique strategic approach of UCI Health Affairs, and that is often called One Health. UCI is unique because it is in the health domain, because it is being purpose-built to advance the future of health and wellness to serve all people. And if that sounds lofty, well, it is. But it's also feasible on the path that the Chancellor set us on 7 years ago, bolstered by the remarkable investment that allowed the founding of the Susan and Henry Samueli College of Health Sciences. So unlike other academic health systems, UCI Health Affairs is being constructed as an alliance across health disciplines, building to minimize the silos that exist in other places between doctors and nurses and pharmacists and public health experts and allied health professionals. Our schools are integrated with UCI Health, our health delivery system, and across centers and institutes. And this allows our Discover, Teach, Heal mission to create a virtuous cycle where we explore, we educate, and we provide care. And every day, what we do gets better. As we seek to produce this best-in-class, team-based, whole-person, data-driven, equitable personal care, this is the structure that lets us get there. And I'm arguing that a vision like this is only possible at UCI because of our extraordinary collaborative nature of the university, and that educating a future diverse healthcare workforce is something we can do in a unique way as a top 10 public university, where over 50% of the students are first generation. And we educate more underrepresented minorities than the entire Ivy League combined. That aspiration, the one that we have for health, we can achieve here. And it gives us a remarkable competitive advantage in the marketplace of ideas and of practice. Next slide, please. Now, to focus all of our units on certain shared purpose, we collaboratively across the schools and units wanted to focus in a limited number of areas over the next 5 years. And I don't mean limited, I mean focus together. So these are the pillars that we identified. And these are the areas we're committed to distinctively push the boundaries. And you can see why they make sense for us, and you'll see how they fit into the capital projects. The first area, the future of health, really is about education and research in health. And when you think about education and what we can uniquely do with our structure, we're talking about the opportunity to actualize interprofessional education and practice in a way that hasn't been achieved over many decades. We're talking about bringing the benefits of integrative health across the healthcare system. We're talking about programs like LEAD ABC and Prime LC, where we are purposefully training underrepresented minorities so that they can serve broadly and in their communities. So the college building and the new Nursing and Health Science Hall building, you'll see, is a place where we are looking for our trainees as doctors and nurses and pharmacists and public health experts to speak the same language. When we talk about research, we're going to talk about the new Falling Leaves Foundation Medical Innovation Building, which is on the horizon, where again, it's interdisciplinary research across the components of the College of Health Sciences. Health equity is in the core of everything we do at UCI. It's the core of what will be the School of Population and Public Health, our training programs, and so many of us are committed to it. And precision health, I think you've probably heard a fair amount of recently because of the founding of the Institute for Precision Health. But I like to pull out a practical example of how it worked and look back to the height of the COVID pandemic, where we were using machine learning algorithms and great clinical care to bring together the data from each patient to inform how we took care of the next patient. And in that process, we were able to give the best care. Our metrics tell us that the survival of our patients with COVID were number one compared to all of the other academic health centers in the country. And our length of stay were 1, 2, and 3. That's the type of benefit you get from precision, thoughtful care. And we are the only academic healthcare system in all of Orange County. So that means we support easily 100 regional hospitals in this ecosystem by bringing tertiary quaternary care and the power of what we do. So let me get to some of our numbers, which is a nice way of rolling up a description of where we stand. We're about 2,900 students at this point. We're over 50% first generation students. You can see these numbers for the percentages of underrepresented minorities in our undergraduate, graduate, and professional population, which is quite strong and growing as it needs to. We are over 10,000 faculty and staff. Last year, we were a $2.4 billion enterprise across health affairs. And our research dollars had grown in the last period to $296 million in external funding. And because Michael is not here to talk about the School of Medicine, I will even give you a window on the year that's coming and the rate of growth that we have. What he tells me is that in the first quarter last year, the School of Medicine brought in $58 million worth of external funding. And in the first quarter of this year, remarkably, we've brought in $113 million in external funding. Unbelievable trajectory. In philanthropic support, so critical to what we do. We had a 60% increase last year to $133 million. And what I really want to focus on today with the other leaders is the 2.5 million square feet of new space that is going to support the work of UCI Health Affairs that's coming online or has just come online and will continue to come online over the next 4 to 5 years. Next slide, please. So I'm going to use this to organize our discussion of capital projects. You can see the new college building and the new nursing buildings on the corner there of Drake and California. We will talk about them. 1/3 of the college building is the new Susan Samueli Integrative Health Institute, which we will talk about. only shown with a bubble, but those of you who drive by know that our 2064 car parking lot is coming up to serve this area. You see a balloon there for the Falling Leaves building. I'll talk about that for a minute, and because Michael's not here, I'll also talk about the Alpha Stem Cell Clinic and infusion space. And then Chad will talk to us about the new UCI Health Irvine Medical Complex a mile away. And just to also recognize everything else that's growing in UCI Health, in the parking lot down there, I put a balloon for things that are happening on the Orange campus and across Orange County. Next slide, please. So just to give an entree into the new college, which I will then ask Dean Hirsch and Dean Bodnar-Bala to talk about. Can I have the next slide? All right, so here are some pictures. Some, I apologize, even I took. But this space is just incredible. You see up there one of the 50 courses that we began to have in the college building just a few weeks ago. And it may be hard to see in the picture, but the students in that classroom, I asked them to wave at you, and that's what they're doing. There'll be a 200-seat amphitheater, which is almost complete, but won't really be fully functioning ready for us until early in January. The spaces in it are just incredible. Overall, there is 100,000 square feet of assignable space, 10 classrooms, 18 conference rooms, meeting spaces for students, faculty, and staff, dry research space, administrative space for the schools and units within the college. And it really is an example of form following function. We're building this to bring the parts of the College of Health Sciences together in what we do. So I'm going to start and just briefly hand over the baton, if I could, to Dean Hirsch. Maybe you can talk a bit about how the space might begin to provide opportunity for your new PharmD students, how it might enhance interprofessional education and practice, especially for the pharmacy students. Jump in and talk to us, please.
Sure. Thank you, Dr. Goldstein. Absolutely, this is an absolutely fabulous place. I'll just say that from the start. And these pictures, if you haven't been anywhere near this, they do not do it any justice. Sorry, Steve, not your photographic ability there. It is incredible. Our pharmacy students have started, and they started we have 2 classes now, and they have been in this building since I guess the end of September. And every time I see them or I talk with them, their eyes light up, and it is just a phenomenal space to them, and they are so grateful to be there. I actually was in one of these classrooms doing a panel last Friday, I think, and just the equipment, the audio visual, the way that you feel in this space, it is so much you can share with people that aren't there, and as well as people that are there. And I think these are not regular classrooms. So to your kind of comment about interprofessional education, because certainly that's one of the things we're trying to do across all of the schools, is to practice interprofessional education. And having these students in these spaces and others, there are places where you can go just sit and they can study, and there are places where there's food, and places that they can just hang out in chairs and outside. All of that is going to bring the students together from the different programs outside of these really, really cool classrooms. They're going to be in the really, really cool classrooms, sometimes together, sometimes separately, but then they're going to walk out, and that's where I think the magic of interprofessional education is going to be happening. And it's going to be happening in this building, but next to it is the Sue and Bill Gross School of Nursing, though is attached. And those students are going to be in all of this space that's not classrooms.
Right.
And so when I was thinking about it, we do interprofessional simulations, and there's amazing simulation facilities in the School of Nursing in there. And when we do those interprofessional simulations, we bring students together with preceptors from the different schools. We all come into the simulation room, and then we go away. We go away to our spot on campus. We won't go away. We'll walk out. We'll still be in these spaces, the students will be able to see each other. And I think as importantly, the students will be able to see the instructors, the faculty from the different schools. They're in the same building. And we as instructors and preceptors for these students will be able to see each other. We won't walk away from each other. And that's where I think the huge leap, which I'm really looking forward to observing between interprofessional education to interprofessional practice is
Yes.
going to start to occur before you even get into the health system. I think it's going to be occurring in these halls. And I'm really looking forward to seeing how this evolves. It's a great space for it.
And absolutely. Dean Boden-Albala, maybe you can add in, talk to us a bit about the spaces, what opportunities for faculty and staff in public health now that you'll be coming under one roof?
Yeah, so I first couldn't agree more with the two of you. This is a fantastic space. It promotes health, it promotes well-being. It's a place where you really feel grounded. There's so much light, and it's just designed in such a beautiful manner. And I would say, we're coming out from COVID. We're coming from a place of growth in public health. And so, we had our first faculty meeting in this space on Friday, and, everybody was giddy. Everyone was excited. And of course, we all had to introduce ourselves to each other, because in this growth, and we've grown exponentially in this growth, all people saw were the like we're seeing now, Zoom spaces. I hope next year, by the way, that when we do this, we can all do this in person. That would be really fantastic. But, it's a place where our faculty can finally live together as a family, and that hasn't happened before. And one of the things I'm most excited about, when we were, and so public health is on the entire third floor, that's how much we have grown. And so we let the faculty decide how they wanted to sit. And this building's very different than other buildings. And so we have these sort of research centers, which are our departments, but the faculty chose to sit amongst each other. And so there are no departmental boundaries in terms of where faculty sits. And I think that starts us off in this great place, thinking about interprofessional education and multidisciplinarity and just the way that everyone interacts. And so faculty really setting the stage for wanting to really think and sort of push the envelope. And our students are going to get that energy and that enthusiasm. To Jan's points, all our students, not just public health students, but pharmacy and nursing and medicine, and the folks that come to the Samueli Institute and really begin to know that this is very different than any other campus across America. And, and I think there's going to be a real excitement, and that's going to help us to be more innovative. And then for our staff, this is mission forward. We have been talking about a school. We have been talking about One Health. We've been talking about integrative health. And this is the place where it's all going to come together. So, I am still thrilled and living off of the giddiness and smiles of that wonderful meeting on Friday. And I just can't wait to move in. And I know our faculty, students, and staff can't wait to move in. Our students are already in. In fact, they're requesting we meet them at the College of Health Sciences instead of them coming to our offices, and we're saying that's absolutely. So thank you so much for really spearheading this, Dr. Goldstein, and for all the wonderful collaborations that we're all going to have going forward.
Thank you, Dean Boden-Albala. So I'm going to try and channel my inner philosopher nurse in Dean Lazenby, because he couldn't be here. So I'm going to show a few pictures. The School of Nursing, the Sue and Bill Gross School of Nursing, is improving health today and for future generations. It has grown at this point to 27 faculty. And looking at the Blue Ridge rankings in NIH dollars, it now ranks 29th among all nursing schools and rapidly moving up. The School of Nursing has 30,000 square feet of assignable space. And it also, in this building, houses the simulation center that Jan was talking about, which is truly remarkable. It has hospital bed units, it has simulation suites, it has this larger room you can see here with the most advanced technologies. These are terrifyingly interesting mannequins. They cost as much as $150,000 a piece, because when you touch them, you can feel the heartbeat and you can listen to the respiratory rate. And as you have different student trainees around the bed, each fulfilling different roles, the mentor can change the program so that as the patient is responding to therapy, just when you think you've done the right thing, something that might actually happen in the hospital happens and you have to think again. And it's being recorded so that you can then sit down afterwards and dissect and analyze what you did in the moment. Truly remarkable. And one of the exciting things for doing this is, as we say, teaching everyone to work at the top of their license and work together across the different disciplines. But it even spans, the way Jan was saying, as it begins to move into practice. The next building over is the Gavin Herbert Eye Institute. The next building in the other direction is the Susan Samueli Integrative Health Institute. The buildings a mile away are going to be the new hospital setting. This is the ground zero for what is going to begin to happen as we do this training very close by in those environments. I think I only put in one slide for him. Can I see the next? Yes, okay, great. So I hope you all tell Mark I did a good enough job for him. I would like to invite Dr. Malik to talk to us about exciting, most recent October 17th events with the new Susan Samueli Integrative Health Institute. Maybe you can move to the next slide and have Shaista talk.
Thank you, Vice Chancellor Goldstein. What an exciting day that was. And I, echo everyone's sentiments about just being in this new space. And we marked the opening of the clinic. Believe it or not, it was prioritized because we really wanted to have our patients experience this amazing space. And so the clinic opened on October 17th. We cut the ribbon a few days before on October 13th. And our special guests included the Irvine Mayor, Farah Khan, and Assemblywoman Petri Norris, as well as our own CEO, Chad Lefteris, our COO, Nate Shinagawa, of course, Dr. Goldstein, the Chancellor, and Susan and Henry Samueli. And so this impressive building represents the next chapter for integrative health at UCI. The commitment by UCI to the mission of integrative health is now palpable, and this space represents a one-of-a-kind integrative health space in the country. The Samueli College building serves as our anchor, showing that this is an academic mission as well. And so the notion of a dedicated integrative health center at the heart of the health sciences quad, where patients, employees, and our own community can access a wide range of integrative services under one roof and use these tools to build a healthier life, was a bold vision. It was originated by Susan and Henry Samueli, but understood and supported by the Chancellor, by Vice Chancellor Goldstein, and the deans in the Samueli College. And what's remarkable about this space is that it's not just an add-on to an ambulatory space or to the hospital, but represents an integral and embedded program that has not just clinical care, but research and education as well. Integrative health emphasizes health. And so that's the key word. It's not just medicine as the necessary foundation for an updated healthcare system that's aligned with our most current knowledge on prevention and makes use of all appropriate therapeutic and lifestyle approaches. Next slide, please. The Samueli Institute is already a national leader when it comes to the volume of integrative health visits delivered. But in this new space, we're expanding on the model of bringing together the best of clinical care, lifestyle medicine, and complementary therapies in a team-based interdisciplinary setting, all under one roof. And so our whole person approach addresses not just physical health, but also emotional and social well-being. And so the care that the team offers in this space is part of a growing healthcare trend that focuses on wellness and prevention. And so this new clinic space encompasses over 21,000 square feet and is our 8th UCI Health clinical site. And this will help us meet the demand for these services by patients. This state-of-the-art ambulatory care center is designed to consider the patient's experience at every turn. We have soothing interior design, calming patient rooms and treatment areas. Over the last 4 years, our team has collaborated with UCI design and build teams and been involved in the design process to create a truly healing environment. Special attention was given to include more natural and environmentally friendly elements and brought in high-tech features, including tunable circadian lighting. Some of the special spaces within this clinic include 42 consult and exam rooms, a lab, an infusion suite, a pharmacy, an intensive cardiac rehab space, group medical visit classrooms, rooms for yoga, mindfulness, and Tai Chi classes, the Palmer Family Research and Conference Center, which will host research lectures, featured events, and conferences, the Masala Nutritional Education Center, which will not only expand the culinary medicine program, but also be a hub for group medical visits and community programs.
Wow.
So in this next chapter of integrative health, we're excited to help more people in the community foster research collaborations and really expand on the innovative educational opportunities within the Samueli College, as well as the UCI campus, and promote One Health. Thank you.
Well, thank you, Dr. Malik. And you know, it's hard not to brag about everything that you're accomplishing at the Institute as you're developing educational programs for healthcare providers at every level of stage, from undergraduates to professional school to fellows and residents and practicing physicians, nurses, and pharmacists. So really, you're leading the research and education across the country, and now you have a site that's suitable to that leadership role. So thank you. Next slide. So for Michael, I just will quickly touch on 2 of the projects going on out of the School of Medicine. Next slide, please. Construction is complete on a new infusion suites in Gross Hall, as well as almost complete on our good manufacturing process space that's in Hewitt Hall. In May, we opened the infusion space, which is this image, which is part of the Alpha Stem Cell Clinic. There are 4 beds on the first floor of the Stem Cell Research Center, and this is really critical for supporting the clinical trials and cutting edge FDA compliant therapies. And beautifully, this is one of the most powerful programs that we have, and refunding by the state of the California Institute for Regenerative Medicine to the tune of $6 billion, 5, 6. It's hard to mess up my billions, but this is the sort of funding that really keeps California and UCI at the cutting edge as one of the leading sites for this work. Next slide, please. And then if you haven't, I'm not seen, at least see the pictures of our almost complete good manufacturing progress space. This will support stem cell and gene therapy initiatives at the Stem Cell Research Center, novel cancer treatments in the Chow Family Comprehensive Center, therapeutic work for companies in Orange County and beyond, so that we can have our scientists produce their novel cutting edge therapies and bring them to patients in trials. And it's really a remarkable space because it goes from clean to cleaner to cleaner to cleaner as you move the materials through so that they're appropriate for putting into a patient. Truly a remarkable piece of construction work in the basement of Hewitt. Maybe it's part of the reason that Michael was going to brag about going from $58 to $113 million in funding for the quarter. Next slide, please. All right, the last little part of this is things that are underway or soon to happen. And I'm just going to quickly talk about the Falling Leaves Medical Innovation Building, and then Chad Lefteris will talk about UCI Health. Next slide, please. So you've probably been hearing bits and pieces of what's going on with the Falling Leaves Medical Innovation Building. All exciting. We got a $30 million naming gift from Adeline and Bob Ma, who's from their Falling Leaves Foundation, to create an interdisciplinary basic and translational wet research building. 200,000 square feet for basic and translational work. And the programs in this building are defined by having membership from across the College of Health Sciences and to pursue projects that UCI can lead the nation in pursuing. Very exciting. And now, on this Friday, we will know who is actually doing the work because we have gone through the 1 year of preparation, the following year of bringing in architects and design teams to compete for the project, and we are now down to 3. And the committee that then judges the 3 of them is going to decide by this Friday, and we will be able to then know who is building it, and the plan is for it to be open by late 2025. It's arguably the biggest building dedicated to basic and translational wet research on the West Coast. Very exciting. And I will say, we are already planning its partner building that we look to finding the donors that will help us complete the first medical innovation building and then help us build the next building. So that's already underway. Next slide, please. And so now I'd like to hand things over to Chad Lefteris to talk to us about UCI Health, please.
Thank you, Dr. Goldstein, and I'll do my best to summarize, but I would be remiss if I didn't say, wow, that's a lot of investment that's happening across all of health. And I think that is super powerful for us, for our community and beyond. So I'm going to talk a little bit about the health system. You can see on the screen here, this is the rendered view of the new Irvine campus, that the main UCI campus. We've turned around from the other view. So this is Jamboree Road in the foreground and the main UCI campus across the way there. It will come out in phases, really 3 main clinical components, and then a lot of other support buildings that are happening. The Joe C. Wynn and Family Center for Advanced Care will open in a little more than a year from now. That's all outpatient space there, includes a lot of the service lines that will be throughout the whole campus, like neuro, orthopedics, spine, oncology, we'll talk about in just a minute. We have the Center for Children's Health and our Autism Center in this building, and urgent care for after hours and weekends, and many, many more in that first building. It has its own dedicated parking structure right there with the solar array on top. Then we will move to the Chow Family Comprehensive Cancer Center. That's the top 4 floors, and the bottom floor of that building is a surgery center for all patients, not limited to cancer. And then last but not least is the bed tower, the hospital inpatient side there in the back corner that will open in 2025, about the same time as the Falling Leaves Foundation building, probably if we line this up appropriately. And those 2 buildings, the cancer center and the bed tower, actually connect below grade. You can't quite see it in this view, with a very large parking structure out front to make it very easy for patients and families to access, park, and get to where they need to be across the entire site, no matter where they're going. So let's go to the next slide, because that new campus is a $1 billion investment. That's with a B. And lots of different programs and services. That's the costs for construction and design and to work everything that you see there. That does not include our investment in additional faculty and other coworkers that will be there. We expect we're going to hire around 1,000 or so new coworkers that will have to run that site. So this map, however, shows how we continue as a health system to expand across the county, going to where the patients are, trying to make it easier for patients and visitors to access our world-class experts, not just here in Orange, not just here in Irvine, if you will, but also at other locations. You can see in the right-hand side, for example, that's our Laguna Hills site that we opened a little more than a year and a half ago now. Very, very busy site already. So again, you'll see more of these showing up. It's about ease of use, ease of access, and expanding our reach and making it much, much easier for folks to get to our locations. And then next slide is the shot that tells you this is really happening. So this is from the same view from Jamboree Road with the main campus off in the distance. And actually some of that plastic on the Center for Advanced Care has now been removed as the glass is now starting to be enclosed on that building. The cancer center you see in the back left, that is now, that's September. So we're a little more than a month out for this next picture should come this week. We'll show the cancer center being topped out at its highest point, and it will show the hospital in the back corner. Foundations have now been poured. 550 concrete trucks lined up last week to pour the foundations. So, so lots of great progress. If you're driving up and down Jamboree Road, you'll see that, but you really only see now that first building and parking structure because the amount of activity that's happening behind that. So great progress right where we need them to be at this moment in time. So Dr. Goldstein, I'll stop there. I think I could go on forever, but you get the point. Great progress right on schedule where we want it.
So actually, stay center stage, because one of the first questions that's come up is what's happening in Orange?
Thank you. So I like to say that this is an and strategy for us for the health system, because Orange, where I sit right now, is always going to be our hub. The resources, the assets, the facilities that we have here, you can't just duplicate all that. No way. So there are programs that we will duplicate, perhaps, but there are programs that will remain only here as well, like our trauma program, our level 1 trauma, the highest level of complexity. You really can't duplicate that. So that will remain here, for example. So we continue to invest here in Orange. We have several new projects that have opened up here in the last year. Another that's already under construction, which is a large outpatient imaging center right here, just adjacent to where my office sits. We recently opened the new research space as well for patient, very easy access for patient trials, et cetera. So we continue to invest here, and meanwhile in the location in Irvine, but also around the county, other outpatient sites around the county as well. Great question.
And it dovetails again to another question for Dr. Malik, which is in terms of access to the integrative health services, will they now all be at the hub, or will they be distributed around the sites that Chad is describing?
So that's a great question. They'll continue to be distributed at the sites Chad described, as well as at the hospital in Orange.
Okay, great, great. And since I've got you, let me ask, there's a question, will lifestyle medicine be incorporated in the future? Many principles overlap.
So lifestyle medicine's always been part of the integrative health model, and that's why we bring in nutrition and exercise. And we're also incorporating health coaches into our team-based model to further enhance the lifestyle component of integrative care.
I'm reading, I understand that we will know who gets the contract to design build by Friday, but when will we know what programs are moving into falling leaves? So that's a good question. The process by which the building is going to be occupied is a competitive process. The faculty groups are putting together proposals to move into the building. Criteria for the proposals, how they will be ranked and scored, was set beforehand. And basically, they're not surprising. They're going to be for impact on the future in a way that UCI can lead. Impact on bringing in funding at the PI level and at the program project level. They all must be interdisciplinary. And so through that process, we will be ranking the strength of programs. In addition, because we need to finish raising the philanthropic dollars for the building, it can't be ignored that we are putting together proposals to raise money to support those programs, both for the capital space, but also so the programs start with funding to give them strength. And in that, we are looking for the strongest proposals to raise money. And my hope for us is that even if we fill the building up and the proposals can raise money, it will help us on the next building and in other buildings so that we can fulfill the hunger that we have for research space and to push the frontiers. So that will be happening as we go forward in the period towards build. I don't know how to answer this question. What will storage and lab space look like in the new building? I guess as of Friday, when we choose the design build, you'll get a much cleaner idea, but really the architectural drawings are to be finished in the first quarter of 2023. So then you'll really have a good sense. But I can tell you that people have been, the committees that came together to inform the groups that were competing to build the building were given a lot of feedback by our faculty. Much of it coincides with the way the new interdisciplinary science and engineering building was built in terms of lab space, write-up space, core shared space, central utilities, and so forth. So it would not surprise me if there's a great deal that is working so well in ISEB that will be reflected in this building. Next, I'm sorry, I'm getting a whole number of things. This question is going to be harder for me to answer than maybe, but I'll try. Are there plans for dedicated classroom support in the college building? My understanding is that central IT is still running the building, but that we have people training the faculty who are driving those rooms so that they are in control of the active learning spaces. I don't know if either of the deans or Shifta, if there's something to add there.
For each one of the schools, we still have our own IT person also that is then working with our faculty and staff and central IT, and in the model as it's set up now.
Got it. Okay. Will management leadership and administrative roles be performed by the same people overseeing the two sites? I think this is for you, Chad.
Yes, sort of. We will not duplicate leadership because of that new campus, but there are some programmatic elements that will absolutely have to have what I call local owners on the ground of that new campus. But as a health system that evolves and grows, we can't afford just to duplicate everything because of each site. So we're looking at a bit of a combination strategy with our colleagues in human resources for workforce development and planning structures. So more to come on that, but yes, there'll be some sharing from the main hub here in Orange, absolutely, to that site and to our other sites as well.
Mm-hmm. Cynthia Hack was very nice to say that she liked the concept of One Health, reminding us that it's been used for many years by the WHO and UC Davis and veterinarians who work in global health who also want to bring interrelated and inseparable work groups together to achieve the best end. So I thank you for that support, Cynthia. I can't claim it. It was there's some very smart marketing people who thought that that's what we should call it. I'm not getting any other questions, so we will. Here's a hard question. Good, someone got in under the wire. And it's not a hard question. How do budget cuts affect expansion over the next 4 to 5 years? That's a great question. The budget cuts are an essential component of keeping UCI strong the way it's been. We went into COVID as strong as we were because we always preemptively, and I say we as if I had anything to do with it, the people who were here before I arrived 4 years ago, strongly build up reserves. So if faced with something that's truly challenging, the forward momentum and the primary goals are not undercut. So it is absolutely true that we need to think about how to deal with the effective budget challenges that we have over the next few years. But that is not going to stop the formation of the new schools, the growth, or the trajectory. If some things have to be measured at a slightly slower pace, so be it. If some of it has to come from greater philanthropic investment, so be it. But our trajectory and our goals are unchanged. And the capital projects and the commitments that you're aware of are being lived up to in the formation of the new schools or these buildings. So the fact is, we all need to work harder to make all of our aspirations happen, but we can work within these criteria and achieve what's in front of us. All right, well, everybody gets an extra 10 minutes back. Thank you all so much for joining us. Thank you for the members of the leadership who have joined us, and all stay healthy, stay well, and onward. Thank you.